Yes, yes. It's sometimes you have to let them get up by themselves because when you try to help, it just hurts more. But sometimes they just can't get up and they have to be uh, transported to a stretcher, just like those major trauma cases. And they are really bedridden. They are really restricted to bed rest because if they put any kind of stress on the fracture site, the pain is just excruciating, it's just unbearable. So those cases are really, really that bad. I see you. I've been there a lot. I used to work on the ER. I used to work shoulder to shoulder with my fellow technicians, and it was tough. It was it wasn't pretty to see for sure. So I have a CT scan, a brain CT scan here. It's a 53-year-old patient, and it says he had a seizure. So let's go for epilepsy on a CT scan. No contrast enhancement, just plain old guesswork. Let's see if we can see anything. I don't know if it's the first time this patient has a seizure or if it's just a a common event. It seems he has some sort of left temporal lobe atrophy right there. See? This left temporal lobe isn't normal. Could be sclerosis, could be some sort of scar tissue related to a previous trauma. Usually, brain contusions are on the frontal lobes and on the temporal poles right there. So this is a very common site of scarring due to trauma. He has a very ugly and twisted nose. Seems like a previously broken nose. Also, he have a deformed right side zygomatic arc, which also looks like a fracture, previous fracture, and his left zygomatic arc is also crooked. So this is probably due to trauma. This is also a shaky, malpositioned exam. So indeed, this might be just yet another case of someone who fell from his motorcycle, crashed his skull on the road, had a major brain injury, and later on got to be epileptic due to brain scars. So let's just do a MPR so you guys can be satisfied with this scarring tissue right there. See, this is all scar tissue, malacia, gliosis right there. This is the superior gyrus, temporal gyrus. Maybe the middle gyrus is also affected. Can't really tell because this is a CT scan, a crooked one. But indeed, there is malacia right there, and it's more than enough for the patient to have an epileptic seizure. See, this seems like scar tissue on the skin of the scalp, and clearly he has some facial deformities related to fractures, to old fractures. He has also an orbital fracture right there. So he is indeed a patient, a trauma patient. Missing teeth, broken teeth, all over the maxilla, sinusitis, and whatnot. So let's go for it. Let's just finish this up and go to the next one. It's other calcifications on the vessels. No, so this is almost a normal exam.